Great. Good afternoon, everyone. My name is Sharon Bogan from Public Health, Seattle and King County. It's great to be with you here today. We have our weekly briefing about COVID-19, and I'll get us started directly with Dr. Jeff Duchin, who is here for an update. You can go ahead, Dr. Duchin.
Thanks, Sharon. Thanks, everyone, for joining. As of today in King County, we've had over 82,000 COVID-19 cases, over 5,100 hospitalizations, and over 1,400 deaths since the beginning of our outbreak just over a year ago. And as I shared with you last week, we are in a much better place today than we were a month ago. Today, I have a mix of more good news as well as reasons for caution. With continued attention to COVID-19 prevention and increasing vaccination, there is a good chance we will be much closer to normal life this summer. However, our case rates have stopped decreasing, and the more infectious and possibly more severe variants are increasing. A few weeks ago, I suggested that our situation is like being in the eye of a hurricane, and although the forecast may have improved, we still need to prepare for potentially stormy weather ahead. Here's our current situation. Overall, COVID-19 cases, hospitalizations, and deaths have decreased significantly since the peaks of the third wave in December and January. Now, that third wave was responsible for 3/4 of our total cases and 1/2 of our hospitalizations and deaths. We're now just over 90% back to where we were when that third wave began last fall. Over the last week, there were 133 new cases reported daily compared to 76 cases daily before the third wave began, and 778 cases a day at its peak in early December. Since mid-February, COVID-19 case rates have fallen the fastest among adults 75 years of age and older, which I think likely represents early protection from vaccination, and that is truly great to see. We've also gone from dozens of outbreaks and hundreds of cases reported from long-term care facilities each week to single digits in the recent weeks. Following the decrease in cases, hospitalizations have fallen to levels comparable to those before the recent spike, averaging about 5 to 7 King County residents hospitalized each day. That's a hospitalization every 4 to 5 hours in King County. Deaths are falling in all age groups, yet a King County resident is currently dying of COVID-19 every 8 hours, 3 a day, down from a death every 2.5 hours or 9 a day in December. So after a relatively long and steep downhill ride, we have a warning light on the dashboard that we need to pay attention to. Over the past 2 weeks, the recent decline in new cases has flattened out. This plateau began about 2 weeks after moving into phase 2 of the roadmap to recovery, as we are increasing our activity and interactions in the community. And we will be watching closely for signs of any increase in cases or an increase in hospitalizations that typically lags changes in case rates by several weeks. Also, despite the falling overall case numbers, disparities in the impact of COVID-19 across the county continue, with rates of cases, hospitalizations, and deaths that are 2 to 3 times higher in South King County compared to communities in Central and North Seattle and Shoreline, Bellevue, Issaquah, Mercer Island, and the East Side and Eastern King County. We continue to focus our vaccination strategy to reach those parts of the county with the highest rates of cases, hospitalizations, and deaths, and I'll share more about that in a few minutes. Just want to say a word about the variants. Genetic sequencing has identified additional cases of variants of concern in Washington state. Through March the 3rd, 43 cases of the B.1.1.7 variant first recognized in the UK, and 5 cases identified of the B.1.351 variant first recognized in South Africa have been identified in King County. However, only a small proportion of all cases are being sequenced currently, about 2.7% of cases since January of this year. Both of these variants of concern are more transmissible, the B.1.1.7 variant may also cause more serious infections. And we're only likely identifying a very small portion of these cases, given the amount of sequencing that's taking place. And most of the SARS-CoV-2 viruses that are circulating are predicted to be the B.1.1.7 variant sometime this month. Although it's impossible to predict the extent to which these new variants may change the course of our outbreak, we remain vulnerable as they continue to increase. If we get too comfortable and don't suppress the spread of COVID-19, if we travel and gather to the extent we did during the summer and winter holiday seasons, we will increase the risk of experiencing another large surge in cases, hospitalizations, and deaths this spring. So we're getting closer, but we're not out of danger yet. Letting up on important COVID-19 prevention measures too soon is like jumping from an airplane and throwing off your parachute before you reach the ground. Continuing in some areas, improving in others, COVID-19 precautions need to persist, along with increasing vaccination coverage over time. That will decrease the risk of a fourth wave. So we both need to continue and improve our COVID-19 precautions. That, with increasing vaccination, will decrease the risk of a fourth wave. Now, let me say a few words about vaccination, because the news is also increasingly good on that front, although increasingly challenging. As of yesterday, almost 600,000 doses have been administered to King County residents, including close to 100,000 doses in the past week. Of the estimated 473,000 King County residents who are currently eligible to receive a vaccine, 72% have received the first dose and 42% have received 2 doses, fully vaccinated. Over 70% of our licensed healthcare workers have received at least 1 dose of vaccine. And it's extremely encouraging to see more and more of our older and most vulnerable high-risk adults receiving vaccination. 71% of residents 75 and older have received at least 1 dose, and that's up from 44% mid-February. 65% of residents between 65 and 74 have received 1 dose, and that's up from 40% in mid-February. So we're continuing to see progress, but we know that the supply of vaccine will continue to be a challenge for us. For context, we have almost 400 providers enrolled with the state to provide vaccine here in King County, but only 24 were able to receive doses for prime doses or first doses for new patients this week because of limited supply and because the vast majority of doses were going to that second dose administration. Now that problem will improve over the coming weeks, and we will have more first doses available as time goes on, but that just gives you a sense of the challenges that we're facing. Now, with respect to equity, that is a priority for us, addressing inequities in vaccine access and ensuring equity in vaccine access. And we are doing work very much in collaboration with community partners that are helping us with this priority. So we still have significant challenges. For example, for adults 65 and older, among whites, 57% have received a single dose, compared with 53% of Asian Americans, 45% of Hispanic Latinx, and 39% for Black and African American adults 65 and older. So although we're making progress, we still have a ways to go. Now, for American Indian, Alaskan Natives and Native Pacific Islanders, the gaps have closed. So American Indian, Alaskan Natives who are 65 and older are 64% covered, which is great. And the figure for Native Hawaiian Pacific Islanders is 75%. Although vaccination rates are increasing in South King County, we continue to see disparities when we look by geography. Among those who are 65 and older, we have very high vaccination rates, 96% on Vashon Island. We have high rates in East King County, 71%, and 65% in North Seattle and Shoreline. Rates decrease as we go south, with 62% in Southeast King County and 56% in South King County. So we're taking action in collaboration with community partners to try and close these gaps in vulnerable areas of our community. For example, community partners mobilized over 150 caseworkers calling 3,000 older adults in South King County to help them register for vaccine at our Auburn and Kent vaccination sites. And this is in collaboration with Aging and Disability Services and the community-based organization scheduled over 1,000 appointments for highly impacted community members in just 2 days. We're also working with community organizations to connect family caregivers, home health care workers, and other elders to set up appointments at King County Vaccination Partnerships in Redmond and Renton. And just last week, these two sites administered over 1,700 vaccinations to these high-risk groups. We also have community-based collaborations with the City of Seattle, who are hosting community vaccination events serving older adults in South Park and West Seattle. These services are tailored to the Latinx community and include Spanish language interpretation and can reach seniors who often experience language, technology, and other barriers to accessing vaccine. And we're planning upcoming events with faith-based organizations to reach communities who face language and other barriers accessing vaccine. And finally, I'm sure you're all aware of the recent changes announced by the state to vaccine eligibility. K through 12 workers at schools and licensed childcare workers are now eligible in phase 1B1. And educators and childcare workers and employees of K-12 schools can use the state's online Face Finder tool to confirm their eligibility and schedule an appointment at locations that have appointments available. The federal officials who mandated this change have expressed that the federal pharmacy partnership, here including Albertsons, Safeway, Rite Aid, Walmart, Costco, QFC, Fred Meyer's, and Health Mart, will be the primary conduit for serving K-12 and childcare workers. And as the supply of doses to these retail pharmacies expands, this will be a key access point. We are encouraging our partners, of course, to continue to reach the elders who are at highest risk of hospitalization and death while serving this new eligibility group. And the last big announcement of the week, Governor Inslee announced a new vaccine phases opening up on March the 22nd, and that information is available on the DOH website. So in closing, again, I want to express my appreciation for all the providers and community organizations who are working hard to connect our elders and members of our community who are at high risk for serious COVID-19 infections to the vaccine. I know this continues to be frustrating, but I feel hopeful that we're soon going to be in a position where our supply chains will open up and those who are eligible will be able to access vaccine much more readily. So my bottom line for today is, again, that we can be cautiously optimistic, but significant risk and uncertainty remains. We need to continue with our COVID prevention measures, good quality, well-fitting masks, avoiding unnecessary activities, limiting activities outside the home, really understanding how this disease transmits through the air from people who may not appear ill at all, up to half of infections from people before they develop symptoms. There's very good information now on the CDC website about how to improve indoor air quality and the importance of ventilation. I encourage all workplaces and other indoor locations to look at that. There's information as well for households on how to improve airflow and decrease the risk of COVID-19. This virus is relentless. We can't let up now, but we need to continue to take all our precautions, hope for the best, but at the same time, being prepared for the worst for just a few more months. So with that, I'm happy to take your questions.
Wonderful. Thank you so much, Dr. Duchin. Just a reminder to put the raise your hand function at the bottom of the screen, and you can let us know your news agency. And we'll get started with Jessamine McIntyre. You are unmuted.
Hi, Dr. Duchin, Jessamine McIntyre here with Q13 Fox. I'm wondering if you know how much allocation of Johnson & Johnson will go to King County, and if so, where will it go?
Yeah, we are still, thanks, Jessamine. We are still working with the state on that information. We know that we'll be getting some doses, but we don't exactly know where they're going to be yet. We will be potentially having some doses at some of our sites. Our King County mass vac sites, the large sites in Auburn and Renton. We're also working with our community vaccinators to understand whether they can use this vaccine. One of the challenges is that they're offering us some doses for next week, but then we know there won't be doses for several weeks before we can get J&J doses again. So how to work that into a clinic's logistical operations is a little bit challenging, but we're hoping to be able to offer this vaccine at several locations in the county this coming week, and we should have more details about that by the end of the day.
Thank you. Will James, you're unmuted.
Hi, thanks, Dr. Duchin. Will James from KNKX Public Radio. So the B117 variant, even given the so far the lack of a rise in cases and the relatively low number of cases of that variant that have been identified through sequencing, that is still projected to be the dominant strain of the coronavirus sometime this month, or has that changed at all?
Thanks, Will, for the question. The projection was made by modelers at the CDC a couple of weeks ago, but it wasn't based on our local surveillance data. It was based on what was known about how that variant has spread in other countries. It's been confirmed in multiple locations, the rate of increase in how rapidly it spreads compared to the previous strain. So it's not, an exact prediction. I mean, it was predicted that, nationally it would be predominant by sometime in March, and then locally, some of our local modelers used available data and confirmed that, came out with the same conclusion. But that said, models are not the real world. Models are predictions, and they are more or less accurate. So I haven't seen a more recent model, but the data, because we do such a small sample, the data are not robust enough, I don't think, to make much of a change, in my opinion, in that prediction. We know that this virus spreads more readily. Someone who has it is more likely to spread it, and others in contact are more likely to acquire it. And we know that, these viruses exhibit what's called logarithmic growth. So they start relatively small and they double with some frequency. And as long as, that number remains relatively small, the doubling number is still small. But then you reach a threshold where you double and you have a big number that starts doubling. And that's when, we start to see it its impact much more apparently. So back to your precise question, I have not seen any more recent modeling that would change those forecasts. The fact that we're not seeing a lot of it is primarily a function of the fact that only less than 3% of the COVID isolates in the state are being tested for it.
Gotcha. Thank you.
Keith Eldridge, you are unmuted.
Thank you. Doctor, your partner next door at Snohomish County this morning said, Dr. Spitter said that cases in nursing homes have almost disappeared. And you mentioned the age group just a second ago, but what's the situation in King County? And if they're not the ones dying, who is dying?
Yeah, so again, when cases fall, hospitalizations and deaths lag behind. So what we see today in the hospital are people who became ill many, many weeks ago. And so the people who are dying are people who've been infected maybe a month ago or so. Going forward, we'll expect to see fewer people, period, dying from COVID as more people get vaccinated. But in particular, we'd expect to see that effect first in the older adults, because they've had access to vaccine, because they're 200 or 100 times more higher risk of dying. So in King County, in the winter time, over the winter months, we were seeing hundreds of cases reported from long-term care facilities and scores of outbreaks reported every week. And since mid-February, we've seen a tiny number, just a single digits of cases and outbreaks. And in some week, 2 weeks ago, we had nothing reported. So we're seeing something very similar. And I think that's been reported across the country and across the world, that beginning several weeks after immunization of elder adults, the numbers of cases and deaths have begun to drop very dramatically.
Thank you, Dr. Duchin. Patrick Quinn, you are unmuted. Let's give Patrick a couple minutes.
Can you hear me now?
We sure can.
Guy. Can you just speak to mass vaccinations? And we know Seattle's in the final stages of potentially opening a mass vaccination site. And I know equity is important for the county, but also high volume efforts will be increasingly important as phasing is soon to be extended. What's the current framework right now in King County, and how important is it to ramp that up?
Yeah, thanks for your question. We definitely have capacity to deliver more than the number of doses of vaccines than we are receiving, both through our large high throughput sites, the so-called mass vaccination sites that we have in Kent and Auburn, and then we also have Renton and Redmond, and then this Lumen Field site is planning to come online. As doses increase. Now we have a 3-week forecast now, which is quite helpful from the federal government. As we see doses beginning to increase, we can look at where vaccinations are needed in the county and determine whether either more high throughput sites are needed or other modalities. So for example, there are some people who can't access high throughput sites, and we use mobile vaccine delivery to reach them. And then there are others who are more likely to be vaccinated at community-based venues. So what we try and do every week is we look at the rates of vaccination coverage across the county, community by community. We look at the rates of COVID-19 illness across the county, community by community. We look at where vaccine access is. And another group I didn't mention was our community health clinics, and our healthcare delivery system have a significant unused capacity as well. So it's quite possible that additional high throughput sites will be stood up and will be useful, but the timing for that, the specific locations really depend on how things unfold with respect to who gets vaccinated at the current sites, where the gaps are, and the number of doses that become available over time. So, for example, the federal government, after we had created our initial local plan, created the Federal Pharmacy Partnership that expanded to all those pharmacies that I mentioned earlier that are playing a significant role in getting vaccine out to the community as well. So we've got a large number of different vaccine delivery mechanisms in the county now, and how we take advantage of all those resources is determined by both the number of doses that are available and where the need is.
Excellent, thank you. And then I believe it's Christine Pei, a new reporter from King 5. Christine, you welcome, and you are welcome to go ahead.
All right, thank you so much. And speaking of the federal retail pharmacy program that you mentioned, from my understanding, we're getting about 65,000 here in Washington State. Do you have a breakdown of how many of those will go to King County specifically?
I wish I did.
Okay. And kind of expanding on that with the federal retail pharmacy program, just confirming that, is that specific to the teachers and educators who now qualify in this 1B tier, or can other people who are qualified within the tiers able to take part in the federal, in the pharmacy program in general? Because I think if there's any clarification, if teachers can only go to the pharmacies to get their vaccine, or later on down the line, later on this month, when the mass vaccination sites open up, can they go there, just so they know where to go when it does become available?
Yeah, Great question. Thank you. The teacher, well, it's not just teachers. Again, I just want to remind everyone, these are workers in school settings. It's all workers, including teachers and other staff. And I also want to particularly call out our childcare workforce that have been, taking care of our children since the first day of this outbreak, and who are also eligible in this phase. The primary access point that was established by the federal government and who will be provided vaccine for this purpose are the retail pharmacies. And we anticipate tens of thousands of doses that will come to the retail pharmacies from the federal government to help address this need. But the pharmacies are not going to be turning away other eligible people at this point. And in particular, we really want to emphasize the importance of continuing to vaccinate, the 100 or 1,000 so 65 and older who still remain unvaccinated in King County. So those older adults are at the highest risk of hospitalization and death, and they should continue to be prioritized for access at our King County healthcare providers. They should have access at the pharmacies when appointments are available, but we're specifically asking that the newly eligible childcare and school workforce to seek vaccine at their pharmacies, community pharmacies first and foremost. But we will be increasingly, as doses become available, serving that population as well at other vaccination sites.
And quickly to confirm, when someone does qualify and make the appointment online, will they get that information once they get their appointment approved? Like, it will tell them where to go once it is approved, whether it's a pharmacy or whether it is later on down the line a separate vaccination clinic?
No, anyone who is eligible for vaccination will still need to make an appointment or have someone help them make an appointment at sites that are offering vaccine. When you're determined to be eligible, you're not automatically appointed for a vaccination site.
Thank you. Let's take a question from Anna Boyko-Wyrock. You are unmuted.
Hi there, KOW Public Radio. Thanks so much for taking my question. Just to follow up on the question of my colleague there, why doesn't the county have visibility into the number of doses in the federal pharmacy partnership coming into the county? And do you have any concerns whether there actually will be enough for the newly eligible folks?
Well, it's a matter, we've been told that the newly eligible folks will be served over time, but it's not going to happen all at once. Again, this coming week, we have 70,000 newly eligible or 75,000 newly eligible in King County through the child care and school workforce. And then we have 100,000 remaining eligible adults, 65 and older. But we've only got approximately, 30,000 first doses allocated for this week. So over time, and specifically the federal government and the state's commitment was through the month of March. Subsequently, enough doses will be made available to get first vaccine into the newly eligible child care and K through 12 workforce that wish to be vaccinated. With respect to why we don't have visibility into the number of doses that are coming into King County pharmacies, it's probably a question that's best answered by our colleagues at the state who have to work with the federal government to get that information and then pass it along to us. Our understanding is that they're having trouble getting the details from the federal government. But again, I'm really not, I'm not sure what the exact barrier is. I do think that they're working hard to get us that information. We've had conversations over time about it. It's quite useful to us to know this. And I think that we will get it eventually, but specifically why it's taking so long, I really can't answer that question.
Thank you. And Dr. Duchin, here's a question, an interesting question from the community about distance, basically, and how much distance is recommended. I know there's been some, there was a JAMA study that looked at potentially whether 2 meters or 1 meter may be sufficient, particularly in school settings. And have you been tracking that issue, and any comments you had about distancing?
Yes. So, the bottom line answer is there's no magic number. So, your risk of acquiring COVID-19 is related to a number of different factors. First of all, important to understand that the virus is expelled into the air when someone talks, coughs, breathes, louder talking, singing, shouting, put a lot more virus out into the air, but it's airborne, it floats around. And what determines your risk is both how close you are to someone else, how much virus they put out, how infectious they may be, whether you're wearing a mask and they're wearing a mask, and the level of ventilation in that environment. And I would personally feel that ventilation and mask wearing are probably most important. And if someone is closer up is higher risk and farther away is lower risk. But in any given situation for the same amount of distance, if the ventilation is good, the risk will be lower. And so that's why I keep emphasizing the importance of paying attention to ventilation and indoor air spaces. It's impossible, there is no, one cutoff where you would say, risk is 0, because it's dependent on the size of the space, the size of the airspace, and how good the ventilation is in that airspace. In a poorly ventilated, enclosed airspace, even 6 feet or more ventilation can pose a risk. In a well-ventilated airspace, close contact may be very low risk. For example, outdoors, even close contact is much lower risk than it would be indoors because of the huge amount of ventilation and dilution that occur outdoors. So, risk is, again, it's a function of distance, it's a function of whether there's a mask wearing, it's a function of the size of the airspace, and it's a function of the ventilation in that airspace. There's not a magic number for any one of those that can be applied to all settings. It's always a matter of considering all of those factors.
Excellent, great. And it looks like we have a couple of follow-up questions. I think we have time for one more. Jessamine McIntyre, did you have a follow-up?
I do, thank you very much. So when it comes to the distribution of the various vaccines that you have, I'm specifically curious about Johnson & Johnson. Are you going to make an effort to get those 2 spaces where it's more likely that those more vulnerable and unable to follow up with a second dose will be had, or will they just be distributed as the others?
Yeah, thanks. I understand your question, Jessamine. It's a good question. So J&J vaccine has a lot of advantages. First of all, it's a highly effective vaccine. It's extremely effective in preventing serious outcomes like all of our current COVID-19 vaccines, particularly hospitalization and death. No one who received this J&J vaccine was hospitalized or died after 28 days after being vaccinated. So it's a great vaccine for protection. It also has shown good effectiveness in reducing asymptomatic infections, which is really great. It's a 1-dose vaccine. So for people who want 1 dose, or as you suggest, people for whom coming back in 3 or 4 weeks for a second dose is difficult or impossible, it's especially good for that situation. And for people who just, prefer only to get 1 shot, or for if side effects are a consideration, this vaccine has fewer of those more intense side effects, what we call systemic side effects that are seen with some of the mRNA vaccines at a higher rate. Things like fever, fatigue, muscle aches, headaches, those types of things that occur for a couple of days, particularly after the second dose. And, sometimes people even need to take a day off of work because they feel really run down for a day or 2. This vaccine has much less of that. So there are a number of scenarios in which those types of characteristics would be most useful. And so we are hoping to use it in those settings where we feel that people can't return for a second dose, or people tell us they prefer to have a first one dose shot, or for some reason prefer this vaccine. So we will be making this vaccine available as widely as possible throughout the vaccine distribution network as more doses become available. But in particular, looking at those scenarios where its characteristics are especially useful, such as people who can't return for a second dose.
Thanks so much, Dr. Duchin. And I missed Nick Popham. I didn't mean to skip over you there. Let's try and get in your question here before we wrap up. You can go ahead.
Totally fine. I appreciate it. Hey, Dr. Duchin, was just curious. You had mentioned earlier about obviously how we have to keep up pace with our restrictions and being safe and cautious and all that stuff. Does it worry you that states like Texas are opening back up? Does it concern you for our county and potential travel that could ensue and things like that?
It does. It's a small world. It's a small country. This is a virus that moves quite readily from state to state, from country to country. I think at one point early in the outbreak, I said it makes about as much sense as having a peeing section in the swimming pool. You really want to see our country succeed in suppressing this virus and in getting back as close to a normal life as possible as soon as possible. And the way to do that is by, controlling it, by minimizing the number of cases, by minimizing opportunities for spread, and getting as many people vaccinated as soon as possible. So by prematurely abandoning precautions, I use the analogy of throwing away your parachute before you hit the ground. It's potentially going to make it more difficult for all of us to return to normal if there are large numbers of people in pockets of this country that continue to have high levels of infection and travel and introduce the virus into other communities. To the extent that more people get vaccinated, the impact of that will be reduced, but it would be much more desirable, I think, for everyone to have as low a level of COVID-19 throughout our country and throughout the world as possible, because these respiratory viruses, they move and they move quite readily from one community to the next, from one state to the next, from one country to the next. So to the extent that we can all do our job and try and protect one another, we will all benefit.
Great. And before I turn it over to you for some final thoughts, I just wanted to point out a couple of resources that we put in the chat. One is related to the new eligibility. You can also look at a Washington State OSPI for educators. They have some information, particularly on the partnership with Kaiser, that will have some other additional options for vaccine for educators and childcare providers. So that may be an interesting resource in addition to the federal pharmacy partnership. And then one additional resource just to call your attention to, we have a new page on COVID community vaccine resources, and that is also in the chat. And that has several videos from how vaccine impacts the body to adjusting for talking about facts and myths. And so there are many, many language resources now available this week on our website. So you can check that out as well. So any final thoughts from you, Dr. Duchin, before we wrap up?
Well, just again, thank you to everyone. This has been a long and exhausting outbreak, this pandemic. Thank you to our media colleagues for continuing to engage and to communicate and give the public information that they can use to make good decisions to protect their health. Thank you to everyone in the community who is continuing, despite the long and difficult and exhausting a year that we've been through, help us get over the next couple of months to a time where we can be more safe and truly relax more safely. And just remember that bottom line, again, for today, it's great to be cautiously optimistic, but we do have significant risk and uncertainty ahead of us. The virus is relentless. Let's continue to protect one another for just a few more months, get vaccinated when you have the opportunity, and we will be in a better place this summer. Thank you.